Gastroesophageal reflux disease is a digestive condition that affects the ring of muscles that sits between your stomach and esophagus. This ring is called the lower esophageal sphincter. Have you ever experienced acid reflux or heartburn following a large, rich meal, or if you go to bed too soon after dinner time? The other symptoms are brought on by stomach acid rising into your esophagus. Periodic acid reflux can be treated at home, but persistent acid reflux or gastroesophageal reflux disease may require medical attention. Over time, gastroesophageal reflux disease can cause tissue damage to the esophagus. Thus, there are several questions. We will stick to them in this video. So, let's get started. First, why does gastroesophageal reflux disease happen? The contents of your stomach should only go downward. Acid reflux is the term for when stomach acid runs backward or up into your esophagus and throat. Acid reflux from the stomach constantly runs back into the esophagus, the tube that connects your mouth and stomach. This is known as gastroesophageal reflux disease. This backwash or acid reflux may cause irritation to the lining of your esophagus. You are sure to feel acid seeping into areas it shouldn't be. The tissues lining your esophagus, which extends from your stomach into your chest and neck, get irritated and inflamed by acid. Nearly everyone has occasionally suffered from acid reflux. It may feel like heartburn, which is a burning pain in your chest near your sternum, or indigestion, which is a burning pain in your stomach after eating. Periodically, a lot of individuals get acid reflux. Gastroesophageal reflux disease can develop, though, if acid reflux occurs often over an extended period. Causes of gastroesophageal reflux disease. You could have acid reflux disease or heartburn if you have it. Physicians believe that hiatal hernias may be the reason in certain cases. Acid reflux is a frequent side effect of gastroesophageal reflux disease and may be caused by the lower esophageal sphincters, lower esophageal sphincter dysfunction. When your lower esophageal sphincter does not seal or tighten correctly, acid reflux occurs. This permits the passage of stomach contents, including digestive fluids, up into your esophagus. Here are the contributing causes of gastroesophageal reflux disease. 1. Regular acid reflux. The main cause of gastroesophageal reflux disease is frequent acid reflux, which happens when bile or stomach acid escapes the stomach and re-enters the esophagus. 2. Abnormalities of the lower esophageal sphincter. The lower esophageal sphincter, a circular band of muscle at the bottom of the esophagus, may weaken or fail to relax adequately, causing acid reflux. 1. Regularly, the stomach. 3. Hiatal hernia. Acid reflux is more likely in cases of hiatal hernia, a disease in which a portion of the stomach protrudes above the diaphragm. 4. Abnormal esophageal contractions. Gastroesophageal reflux disease may be exacerbated by problems with the esophagus's coordinated movement. 5. Prolonged or slow stomach emptying. Acid reflux may result from delayed stomach emptying. In addition to the primary causes, several other factors might increase your risk of developing gastroesophageal reflux disease. 1. Obesity and being overweight. 2. Being pregnant. 3. Delayed stomach emptying, gastroparesis. 4. Connective tissue diseases such as lupus, scleroderma, and rheumatoid arthritis. 5. Some dietary and lifestyle decisions may exacerbate it. Smoking. Some foods and beverages such as chocolate, fried or fatty meals, coffee, and alcohol, large meals. Eating too close to bedtime. Some types of medication such as aspirin, benzodiazepines, tricyclic antidepressants, and hormone therapy medications for menopause. Before we continue, if you're enjoying this video, don't forget to hit that like button and subscribe to the channel. It really helps us and let us know what kind of content you want to see more of. Now let's discuss the symptoms of gastroesophageal reflux disease. Acid reflux disease, also known as heartburn, is the most typical gastroesophageal reflux disease symptom. Usually it feels like a sharp ache in your chest that travels up to your neck and throat from behind your breastbone. A lot of people report feeling as though food is returning to their mouths, leaving behind an acidic or bitter taste. The burning, pressure, or discomfort of heartburn can linger for as long as 2 hours. Usually it gets worse after eating. Additionally, leaning over or lying down might cause heartburn. Many patients find that standing up straight or taking an antacid that removes acid from the esophagus helps them feel better. There are distinctions between the pain of heartburn and that of heart disease or a heart attack, which is occasionally the case. While resting may lessen heart disease discomfort, exercise may exacerbate it. Physical exercise has a lower correlation with heartburn pain. You can't tell the difference though, so if you get any chest pain, get medical attention immediately. In addition to discomfort, you could experience vomiting, nausea, smelly breath, breathing difficulties, a difficult time swallowing, loss of dental enamel, feeling that there's something solid in your throat. Having acid reflux at night might also mean that you have a persistent cough, asthma that strikes quickly or worsens in laryngitis, sleep difficulties, treatment for gastroesophageal reflux disease and home remedies. Therefore, if you have any of the previously listed symptoms, you likely have gastroesophageal reflux disease. You should contact your doctor to discuss your choices for the following phase of treatment. The goal of gastroesophageal reflux disease treatment is to reduce reflux, or the harm that reflux materials cause to the lining of the esophagus. To address your symptoms, your doctor can suggest over-the-counter or prescription drugs. Antacids. These medications help prevent heartburn by neutralizing acid in the stomach and esophagus. A lot of people discover that over-the-counter antacids offer fleeting or incomplete relief. For certain people, combining an antacid with a foaming agent is helpful. Scientists believe that these substances create a foam layer over the stomach to prevent acid reflux. However, prolonged antacid usage can cause a buildup of magnesium in the body, altered calcium metabolism, a change in how the body breaks down and utilizes calcium, and diarrhea. Renal patients may have major consequences from excessive magnesium intake. See your doctor if you require antacids for more than 2 weeks. Acid pumps, also known as proton pump inhibitors, are medications that obstruct a protein required for the production of stomach acid. Proton pump inhibitors consist of pantoprazole, Protonix, rabeprazole, Acifex, omeprazole, Prolosec, lansoprazole, Prevacid, esomeprazole, Nexium, and dexlansoprazole, Dexilant. H2 blockers. The doctor may prescribe drugs to lower stomach acid if you have heartburn and persistent reflux. Among these medications are H2 blockers, which assist in preventing the stomach's production of acid. Cimetidine, Tagamet, famotidine, Hepcid, and nizatidine are examples of H2 blockers. Prokinetics. In some situations, these medications aid in the quicker emptying of your stomach, reducing the amount of acid that remains. Additionally, they could alleviate symptoms including nausea, vomiting, and bloating. They may, however, potentially have detrimental side effects. Many people are unable to handle them, and those who can use them should use them sparingly. Domperidone and metoclopramide, Clopra, Metazolve, and Etazolve, Reglan are 2 examples of prokinetics. Dietary and lifestyle modifications. The doctors may advise you to modify your lifestyle in a few ways to help reduce your gastroesophageal reflux disease symptoms. 1. Meals and drinks that can relax the lower esophageal sphincter should be avoided, such as chocolate, peppermint, fatty meals, coffee, and alcoholic beverages. 2. Citrus fruits and juices, tomato products, and pepper are among the foods and drinks that should be avoided if they trigger symptoms due to their potential to irritate a damaged esophageal lining. 3. Less portions. Reducing the size of meals may also aid in symptom management. Additionally, eating meals 2 to 3 hours before going to bed allows your stomach to partially empty and the acid in it to decrease. 4. Eat gently. Chew each meal slowly. 5. Cook your meal well. Setting down your fork after a bite could make it easier for you to remember to do this. Only until you've fully eaten and swallowed that mouthful may you pick it up again. 6. Quit smoking. Smoking cigarettes weakens the lower esophageal sphincter. It's critical to give up smoking to lessen gastroesophageal reflux disease symptoms. 7. Elevate your head. Using 6-inch blocks or a specially made wedge to raise your bed's head will reduce the force of gravity, causing your stomach's contents to reflux into your esophagus. Avoid using pillows as self-support. That simply makes the stomach feel more compressed. 8. Maintain a healthy weight. Having too much weight might exacerbate symptoms. Losing weight is a relief for many overweight people. 9. Dress loosely since restrictive clothing puts strain on the lower area of your esophagus and your tummy. 10. Acupuncture. In one trial, acupuncture therapy was more effective than proton pump inhibitors in stopping reflux in the test group, and the effects remained longer. Although larger research is needed to verify this, preliminary findings are encouraging. If you have heartburn, you're not the only one. Generally, these infrequent occurrences may be adequately addressed with lifestyle modifications and over-the-counter drugs. However, you could have gastroesophageal reflux disease if you get heartburn more than twice a week, and modest lifestyle adjustments aren't relieving the problem. If you are diagnosed with gastroesophageal reflux disease, your physician will assist you in determining the best course of therapy. Don't let chronic heartburn prevent you from going about your daily activities. If you think you could be experiencing gastroesophageal reflux disease symptoms, consult a physician. Share with us your experiences and opinions in the comments below. Thanks for watching.